Mm-hmm. Helping with his self-image despite the losses. That would be an ongoing important issue. Yeah. How would you facilitate the grief that he must be feeling about his identity, the loss of his family, now living in another country?
I kind of want to say with silence, because a lot of times just allowing that presence, being there, besides him.
Silence. Maybe making process comments about how I would feel, or how most people would feel, or how my brother might feel. Yes.
I would feel really hesitant though, which I'm fresh, I've never even done this yet, but just hesitant because it seems like on the surface, everything seems so fine. You know what I mean? Like he's okay with his wife leaving him. He's okay with maybe I'll get a divorce. He's okay with having lost like his status in like that providing role, as well as like being a fully functioning human. To have all of that loss occur like essentially, I don't know how you would approach that to not just have everything come like shattering down on top.
Too overwhelming. You'd be careful not to risk severe depression.
Yeah, because
So-
since they're all so
Mhm.
closely tied to
Mhm.
each other,
Mm-hmm.
like just trying to find that kind of way to get a slower approach to it, I guess.
Mm-hmm, mm-hmm, yeah. I do think that we always have to be careful in exploring trauma and loss about how much to do and how much to pull back on, depending on how a person deals with it. Over here and then over here.
Whether or not he chooses to stay married to his wife, he will always be a father and a son.
Mm-hmm.
And so to work with him around those issues, how that may have shifted, both in terms of his strengths and in terms of his losses in his own mind around what he may or may not have lost in terms of, can he be a father? Can he be a son? Is he still a father? Is he still a son? Despite the fact that he's lost much of what he sees as his life.
That's an excellent point. An excellent point. That's the part of moving on, in a constructive way. Constructive way. Other thoughts or feelings about this case?
I'd like to have a discussion about what he feels he has lost.
Yeah. Yeah.
And something that I've been experimenting around with, maybe asking to bring in a picture of himself
Before the accident. That's a good point. Now, what would you expect to get from that, to have him bring in a picture of himself before the accident?
To be more real.
Make it real.
What he's lost.
About what he's lost. Yes.
I actually do a lot of work with people like this, and
People with disabilities.
people with disabilities, people who've gone through traumatic events that have resulted in some sort of loss, generally physical disability or that sort of thing. And I do a version of that where I'll say to somebody, tell me a story of who you were before this happened to you. And then we'll spend a lot of time. And then I'll say, tell me a story of who you feel like you are now. And sort of get a sense of where those differences are, to use that as an approach for being able to start talking about it.
That's a very good that sounds like a very good strategy. Have people talk about what they were before, so an example of how they were before the event or accident that caused the change, and then have them describe how they are now.
Right, and I have them use a lot of detail and elaborate.
A lot of detail and elaboration. Yes.
Actually, that kind of builds on what I was going to say, is that I would want to use more curiosity like that than an empathy piece that I kind of parroting again, my class was supporting about the depression piece. But not wanting to shame my client into feeling like, well, you're not feeling things, you're not thinking about things, and therefore you're not going through this process the right way.
Very good point.
Really asking a lot of questions and doing some exploration about where I'm curious, instead of trying to empathize with a client who may not have access to any of the emotions that I or anybody else in this room would expect.
That's a very good point, because what you're talking about is going where the client is, not shaming them because they're not doing the traditional expectation of psychotherapy, but sort of asking them to talk about where they are in regard to a number of different issues. That's an excellent point. Excellent suggestion. Yes.
In that spirit, I think early on, I might
That's a good suggestion as well. Ask him to talk about his perception of his mother's expectations of what he would get from therapy. Yeah, and maybe that would cause him to go back and have a discussion with her about that. Hey, Mom, why did you think I should come? Yeah, go to therapy. Yeah, okay. Excellent, excellent comments. You know, part of the benefit of discussing cases is the richness that comes from practitioners in terms of the ideas and suggestions and so on. And I can see and hear the culmination of what several of you have gotten today from the various workshops and keynotes that you've attended, that we've all attended. So this is a rich experience. We only have a minute or two left, so let me just make a couple of summary comments. One of my points is that it's not enough to have good, solid psychotherapy skills in order to be competent. That's a necessary but not essential. That's essential but not, what is that statement? What's that? Sufficient. Yes, it's necessary but not sufficient. We have learned that it's vital to more thoroughly understand individuals, partly through understanding the social construction of their identity groups, family members, peers, cultural models, teach us all a confusing combination of characteristics and skills, and we have to assess those for each of our clients and patients and understand how those help or hinder their mental health and well-being. Men in particular have to overcome the negative stigma of psychotherapy. We have to convey our understanding of the values that are inherent without judgment, even when those values lead to destructive behavior. Rather, we must demonstrate destructive patterns in hearable ways to our clients, which I think a point that you were making. We have to make sure that whenever we hold a mirror up to show that what they're doing or how they're being or how they're coping is not helpful, we have to do it in a way that's going to be hearable to that particular person. And we, in the process of doing so, we have to make sure that the client or the patient experiences our care, our concern, our understanding. Remembering the humanity of those with whom we work is a key strategy in doing so. Sometimes it's a long process for a male client or patient to accept the offer of assistance and to become comfortable with identifying and discussing emotions, especially the vulnerable ones. We have to monitor our own biases and discomfort with seeing a weak and vulnerable man who may suffer from depression, anxiety, fear, and grief. And I think that is a little bit of what we were feeling in here, thinking about this client that we just discussed. Seeing a man be that destroyed physically and emotionally is very hard for us because our expectations is that men are strong and not vulnerable. And so we have to look at those feelings in ourselves as well. So I appreciate you coming, and I appreciate your involvement and participation. It's been very helpful, very interesting. So thank you very much.